Good morning. So this is our presentation on the vertebrobasilar insufficiency. I'm Mace McCormick and my partner here is Acacia Alexander. So the objectives for our presentation are to define vertebrobasilar insufficiency and what causes it, define the signs and symptoms, review potential functional limitations, identify tests and measures used for this diagnosis, discuss differential diagnosis of vertebrobasilar insufficiency, outline rehabilitation protocols and phases, and discuss the likely outcomes.
So this condition is just an inadequate blood flow of the vertebrobasilar artery. This artery supplies blood to the posterior aspect of the brain, and this condition is also called bow hunting syndrome and head turning syncope. It is also known as a stroke of the posterior aspect of the brain, and what forms the vertebrobasilar artery is just the two arteries. Right here you see the vertebral artery, this side is the vertebral artery. It forms together to make the vertebrobasilar artery. So it supplies blood to the cerebellum, the medulla, midbrain, and the occipital cortex. It also contributes to balance and movement, and it just puts patients at an increased chance of stroke. This condition is caused by narrowing or damage of the arteries. And then we have the signs and symptoms. So a good way to remember these signs are, it's the mnemonic 5 D's and 3 N's. The A and N stands for the A. So you have dizziness, which is the first one, that is just like vertigo. You have drop attacks, that's a sudden fall without loss of consciousness. So your muscles just give out and you just fall to the floor. Diplopia is double vision. Dysarthria is motor speech disorder, making it hard to form and pronounce words, as well as dysphagia. They work together and they both cause a disturbance in speech. You also have ataxia of gait, which is just poor motor control and clumsiness, and then nystagmus is just rapid, repetitive, uncontrolled eye movements. The most common symptom is a unilateral headache, which is a headache on one side of the head, and then nausea. Those are both the most common symptoms. It also is common in patients over the age of 65, and any of these symptoms can result in VBI.
So as Acacia pointed out, some of the signs and symptoms, some functional limitations of this would be difficulty walking, trouble swallowing foods and liquids, challenges performing everyday activities, ADLs, difficulty sleeping, since VBI is more of a positional type of diagnosis. They have trouble sleeping at night, problems with communication, and trouble with fine motor skills. And some of the tests and measures to diagnose this, the gold standard would be conventional angiography, and this is a method that shows the arterial lumen, which is a hollow space in the artery that allows blood to flow through it. And it shows blockage in the carotid and vertebral arteries as well. Some more imaging would be CT scan or MRI, which takes pictures of the blood vessels in the posterior section of the brain. MRA, which takes 3D pictures of the blood vessels. A ECG, which measures heart activity, as we know. The Holter monitor, which is seen in this picture, and this is where you wear basically a portable ECG for 24 to 48 hours, and when you go for your checkup or your next visit, that's when your physician will look at it, see if anything's off, abnormal. So that's a way, and then vertebral artery test, which we learned in here. And there's also a screening procedure according to Dutton's on the initial visit to physical therapy. And there are two positions for this. The initial test would be a sitting position, so you have the patient sitting down on a plinth, and you have them rotate their head all the way one way and all the way the other. And during this, you're looking for a dizziness sign, just looking for that. And then the other one is a standing position, where you have the patient standing, you hold their head steady, and they rotate their trunk as far as they can, both sides, while their feet are still fixed. And during this, you're looking for dizziness as well.
So some differential diagnosis, you have cervicogenic dizziness. This type of condition, it has no latency period, and latency is just the time that passes. So in VBI, you will see about 18 seconds between symptoms. Also, a major factor to differentiate VBI from the others is maintained head position. So in BBI, you have dizziness with just standing here like this versus the other conditions, if you're moving, that's when the dizziness appears more. You also wanna look for symptoms, cervicogenic dizziness is related to neck conditions causing both dizziness and neck pain. So BBI is just not with neck pain. So if a patient comes in and they're saying they have dizziness with movement and neck pain, that would be BBI.
So the rehabilitation process for this diagnosis involves 5 key things. Number 1 being patient education. The second being interprofessional collaboration, especially with speech therapists, getting them their communication back, occupational therapists to help with their fine motor skills, and the physicians to let you know like what's underlying, how it's improving, how it's progressing, things like that. Vestibular rehabilitation exercises including balance, gait, training eye movements, and improving coordination. Also, manual therapy can be done for this, but according to Dutton, grades 1 through 4 are safe, and grade 5 should not be performed on patients that have restricted or slow blood flow. And there is also some surgical interventions for this. So for the rehabilitation process for this, the rehabilitation process for individuals with BBI emphasizes patient safety, symptom management, and improving quality of life. So for the max protection phase, as I said, like patient education would be big for this. So we would educate the patient on how to reduce the risk, such as making sure their blood pressure is under control, refrain from smoking, blood sugar control, and to maintain a good diet and a good exercise regimen. During this phase, we'll also be performing passive range of motion to kind of get the body moving, isometric exercises to work on strengthening, and a eye movement control, which is where you would have 2 sticky notes, like say 10 feet apart, and you would put them probably about 10 feet apart as well, and you would tell them to just move their eyes, not their head, to each sticky note. And then as you progress, you would tell them to move their head with the sticky note. The moderate phase will be progress to active range of motion and begin light resistance training. This is also where you would implement balance training and gait training to make sure they're able to perform specific ADLs and get to places, and they don't have the drop attacks as Acacia mentioned earlier. For the minimum protection phase, this is where we would increase that resistance training regimen. We would also progress to the gait training, so have them, work on like sidestepping and things like that, other than reciprocal gait. We'd also perform functional exercises and begin aerobic exercises to build up strength. So as I mentioned earlier, there is surgical procedures for this, but it depends on the location of the blockage and if the lifestyle changes that I mentioned before are showing no progress. So the first being an endarterectomy, which is where the surgeon removes plaque from the artery. Bypass grafting, which replaces the damaged blood vessels in the heart to get more blood flow. Vertebral artery reconstruction, which fixes damaged arteries carrying blood to the brain.
For the likely outcomes, patients are most likely to go ahead and have a stroke, because just like any other artery, when you have insufficient blood supply or a clot or some type of disturbance of the artery, it leads to stroke. So it's the same for these, but it's just the posterior aspect of the brain. In this condition, you have extensive rehab for months just to improve speech, gait, and swallowing if a stroke has happened from this condition. There is a 10 to 15% reoccurrence for this condition, and most become disabled, and this is just coming from stroke. So whatever the stroke leaves a patient with, that's why most people end up being disabled for longer periods of time. And all of these depend on severity, age, comorbidities, degree of neurological deficits. And just a quick overview, vertebrobasilar artery is an artery that supplies blood to the posterior aspect of the brain. Insufficiency of this artery causes stroke. You can remember the symptoms by the 5 Ds and 3 Ns. And then patient education and interprofessional collaboration is very important. And this condition can be life-threatening if a patient comes in and they're not already diagnosed with this, and you suspect that they have these symptoms. It's important to get them to the hospital to get checked out before proceeding with therapy.